All right, ladies and gentlemen, let's get right into it. What is a dental laboratory? A dental laboratory manufactures and customizes various devices that the licensed dentist needs to take care of their patients. Okay? And so when the assistant, is of course assisting the doctor doing these treatments, it could be us taking impressions like this one here for maybe a crown or a bridge, right? We could be taking an impression like this to create a device like this, which is a removable partial denture. We could be doing a night guard impression or scanning. Nowadays, it's a lot of companies, or I should say dental offices, that are doing the scanning, the digital scanning. For that, you wouldn't be physically sending an impression. We would actually be just forwarding files to them. Okay, so it's just the digital version. But this is like a night guard, or it could be something like this, where we are needing a crown fabricated, or even a implant supported crown. Okay, so long story short, in the dental office, we typically do not have the tools, the equipment, and honestly the skills to fabricate those type of items and more, right? And so what we will do, like I said, is transfer either digital files, impressions, pictures, and or literally impressions. We will mail this over. In addition to what the patient's mouth looks like, the imprint, right? We will also include what we call a prescription. Okay, so for every single device or thing that we need this dental laboratory to make or to customize, we will always have a prescription enclosed. And the prescription is giving the laboratory in detail exactly what we need, exactly what material we're wanting them to fabricate it in. We are asking them for the specific shade, okay? So you're using a shade guide if you're doing, I don't know, let's just say a veneer. If you're asking the lab to fabricate veneers on 8 and 9, right? That is a very specific shade of the patient's teeth that you want the lab to make, right? You don't want to just send impressions, whether it's digital or the actual imprint, without describing exactly the shape, exactly the shade. And so on a prescription, which is signed by the licensed dentist, the laboratory can open up the email file, or they'll open up the lab case box that you sent them with the prescription, and on the prescription is going to give them the details of exactly what you need. Okay, so that is what a dental laboratory is. Okay, and like I said, they are able to fabricate everything and anything for the most part that we need for our patients' care. All right, so number 2 thing that I think you should just know just in general about dental laboratories is that they can be local, meaning they could be like right up the street from where you guys are, where your office is, or in the city, or even in the state. We kind of consider that local. Typically, a local lab is one that's going to be in driving distance for the most part. And in my past, in my history, when we are working with very high production cases, so basically, guys, cases that cost a lot of money. So this is typically going to be super cosmetic cases. This is going to be 8 veneers on the maxillary, 8 veneers on the mandibular, or some very extended or intense bridge work of some sort. Very aesthetically pleasing or desired cases that patients are wanting. In my past, the doctors that I have worked for, we prefer to work with a local lab. Just because there has been times where during the case that the lab tech has came over while the patient was in the chair to help us customize it. So if we were ever unsure about the shade or the shape, because this is what they do all day, every day, it was very nice to have the lab come into the operatories to help us assist with filling out that prescription. And it just was they were very easy to access. I'll say that. There's also labs that are not local, and this could mean we are shipping it off or sending it off to a totally different state. And sometimes, in some cases, a totally different country. Okay, so every doctor has their preference of labs, and sometimes, like I remember for me with Dr. Boyd, she preferred a specific lab if we were sending it out or needing dentures or partials fabricated. And so she just had her favorite lab for dentures and partials, removable devices. Okay, and then when we needed something like crowns and bridge, something more fixed, crowns and bridge is a fixed replacement. We are cementing it in the mouth. The patient should not be able to remove a crown or a bridge at home, right? She preferred a totally separate lab for that. So again, like you guys know, or like I'm trying to instill in your brain, it literally boils down to the doctor's preference. And you get to learn that. You'll get to know, or you have to make a note of knowing, okay, I'm sending out for partials, I'm sending it here to the local lab. Okay, or I'm sending it out, I need to get a bridge made, I'm sending it out to a lab in California. And so that is also a very important thing for you to know, whether your labs are local or whether they are out of state, out of country. Okay, and so before I end this video, I do want to make it a point to clearly mention a lab technician. Okay, so the lab technician is the individual who, on the other end of receiving these cases from us, from dental offices, they're the ones actually fabricating and making these devices. Again, whether it's a denture, whether it's a partial, whether it's a bridge, whether it's a retainer after orthodontics, the lab technician is the individual who is fabricating and making and creating all of the devices that we are ordering and sending in to them, okay? And another cool thing about becoming a dental assistant is you yourself, one day, maybe you have an interest in not so much chairside assisting or being a clinical assistant. With all of your knowledge that you gain as being a chairside dental assistant, and you just overnight or over time grow an interest in just creating and just being in the lab, being in art class, I think about it as, right? You can become a dental lab technician, which is super cool, because just the other day on my Facebook, I was scrolling around and I seen one of my previous students. You guys, I have been doing this for a while now, so I want to say it. She has been an assistant for at least 6 or 7 years now. So in our state of North Carolina, she is definitely a DA2. But basically, you guys, she is no longer a chairside assistant, and she was posting some dentures that she made. And so she's making dentures, and that's why, again, another beauty and benefit of becoming a dental assistant is because there is so much for us to do. If you get bored or if you gain interest in doing something else within the dental field, you can 110% pivot. You absolutely can. You absolutely can. So I was so excited to see her post about that, and I had to I commented and loved the picture, but I sent her a message. I'm just like, oh my gosh, girl, I'm so proud of you. When in her post, she explained how happy she was and how proud of her work she was, and I just wanted her to know, like, I see you, I'm so proud of you. She is a walking testimony of the things that we tried to instill, or the things that we tried to share in the individuals that are just interested in dentistry. You really have to come in and make it your own. And so that is a story that I wanted to share with you of one of our previous students from DA Academy that is now a lab technician. And she's not the only one. She came to mind because I recently seen a post that she made. But yeah, making sure that you understand the options are out there. Okay, so in this video, hopefully you clearly understand, and if you have any questions, please comment on this video. Comment on this video so I can answer your questions. But I need you to know what a dental laboratory is. Basically, they manufacture and customize the devices that we need. I also mentioned, just to make sure you understand, there are some laboratories, dental laboratories, that are local, and there are some that is out of state, out of country, and it is important for you to know, depending on what you need fabricated, which lab you're sending it to, okay? And the last thing is making sure you understand who is actually making these beautiful devices that is being sent back to us, and that job role is called, or title is called, a lab technician, a dental lab technician. They are the ones who are actually making the things that we are requesting, okay? And so hopefully, again, you took from this video. Let me know if there's any questions, comments, concerns, or video requests so that I can best help you. Thank you for watching the video.